Lesson 5. Educating others and raising awareness. As you have learned, addressing ACEs on an individual level is important, necessary work. But it's equally important to engage in efforts to prevent ACEs and their effects at the community and societal levels. The medical community has a long tradition of bringing about change to improve health outcomes for all children and for all families. As discussed previously, you can start by identifying effective local resources to which you can refer your patients and their families. You may also wish to assist these organizations by donating your time to help educate staff and volunteers about ACEs and related issues, or by providing educational workshops for clients. The following are examples of activities you can participate in. 1. Support positive parenting strategies. We all know that parenting is hard work, but it can also be fun and rewarding. There are many parenting strategies and tips that you can discuss with your patients to help them build a safe, stable, and nurturing relationship with their child. Share parenting resources with patients to help them handle common parenting challenges. 2. Raise awareness by educating people about what works to prevent ACEs. Talk to your patients about strategies that address the needs of children and their families. Some strategies to highlight include home visits to pregnant women and families with newborns. Currently, 18 home visitation programs have been reviewed and approved by the Maternal Child and Health Bureau and the Department of Health and Human Services to be used in the community to prevent ACEs. Positive parenting skills and family relationship approaches. Provide parents and caregivers with resources that teach behavior management or refer them to parenting classes. In these types of programs, parents typically receive information about child development and the causes and consequences of violence, anger management skills, problem-solving skills, and discipline techniques not involving physical punishment. Intimate partner violence prevention. Encourage your patients to get involved with programs that teach skills and promote expectations for healthy, non-violent relationships. Social emotional learning programs teach skills such as empathy, respect, healthy communication, and conflict resolution skills. Healthy relationship programs for couples focus on improving relationship dynamics and individual well-being by improving communication, conflict management, and emotional regulation skills. 3. Invest in community-based mentoring activities. These include after-school programs, physical education programs and rec leagues, music and art programs, faith-based groups, cultural organizations, and other groups that provide supportive relationships for vulnerable children and help them cope with adversity in an adaptive manner. 4. Educate people working with preschool and elementary school children about the adverse, potentially lifelong consequences that toxic stress experienced in early childhood can have on learning, behavior, and health. This may include classroom aides, after-school providers, childcare providers, school nurses, and staff that help develop the curriculum. There are also specific actions you can take at the societal level. Take a moment to review examples of preventative interventions that pediatric medical providers can support.